Okay.
Brilliant. All right, so welcome, Saran. Thanks so much for agreeing to do this podcast with me. So, for our listeners, could you just please introduce yourself and tell us a bit about you?
Yeah, so hi Lorna. Thanks for inviting me. I'm Saran. I'm a patient and public involvement and engagement manager. I work across Guy's Cancer and KCL. I work in the Transforming Cancer Outcomes team, under the supervision of Professor Mika van Helmerick, and I also coordinate the PPI Cancer Research Group for Diverse Backgrounds.
Amazing. So we we often hear about um, lack of data on Black, Asian, and minority communities. So, what would you say are the risks when those particular groups are missing data sets,
Yeah, so
data
there's a
sets?
huge impact, there's a massive real world impact because if we're only testing, treatment and new technologies on restricted populations, then we won't know how these treatments and technologies react in other groups. So, I mean, this can affect, the efficacy, the effectiveness of drugs. We don't know how harmful some might be in terms of toxicities or side effects, and it ultimately, widens the health gap.
And can you share an example where poor representation of these groups has led to maybe unusual, unequal, or even harmful outcomes?
Yeah, so I think a recent one was the pulse oximeters. So it's those devices that measure your oxygen levels. And they were, I suppose, they're frequently used in hospitals, particularly during the pandemic, and because they were only tested on, a certain group, on, I would say, the white majority or lighter skinned individuals, these devices couldn't detect oxygen levels accurately in darker skin. And this had an impact, obviously, on outcomes for patients who had COVID during the pandemic. And even for example, like, these shopping malls that have these very sophisticated taps. And I don't know, I always struggle to get it working. They're supposed to just turn on once you put your hands there, right? Or a soap dispenser. And I look next to me, and the person next to me the water's flowing, they can't quite readily wash their hands, but for some reason it's not detecting my hands. And this is because these devices aren't tested on Black populations, or darker skinned individuals. Hence it's not detecting my hands as it would someone of European ancestry.
Darren, I had no idea. I mean, what you have just described, when I look and I think, how do these things work? I'm thinking I'm doing it wrong, but
Exactly.
then I'm thinking, well, all you have to do is just put your hands there.
Yeah,
Unbelievable.
and that's exactly why. Yeah.
It's only tested on certain groups, and other groups are and not included. It's quite
So it
serious,
has
isn't
you can see the real world, the day-to-day real world impact. Yeah.
it? Yeah. So why do you think, in your view, why do you think certain communities are still invisible in research data?
I would say, it's systemic. It's years of minoritized groups being forgotten, and it's embedded within our culture, and whether it's conscious or unconscious bias, you know this is how many teams have operated. They just seek the most convenient individuals to engage with, which is frequently those who are considered the ideal participants. So they have access to the internet. They're usually educated, highly motivated. So I would definitely say it's a systemic issue that needs to be addressed.
And what does inclusive research design look like in practice?
So inclusive research is about engaging people of different ethnicities and capabilities in research. So throughout the research cycle, you know, from design straight through to implementation and evaluation, and it's about sharing power. So instead of coming to patients and the public with an idea and asking for their feedback, however the decision ultimately lies with the researcher. It's not about consultation. So it's about working in partnership, actively working together and sharing the dynamics of power.
And then you get more engagement because you're saying it's only people that are, I mean, it's quite difficult, really. If people haven't got access to the internet, how do you, which we think everybody has, but of course, not everybody has in the way that, some people, and it depends what people look, if you're on the internet, especially social media, what you're looking for, then algorithms show you certain things and it won't show you certain other things. So it will never pop up. So there'll be groups who never see
Yeah.
um opportunities to take part in research. So that's a lot of work, isn't it? A lot of groundwork to
Yeah. If you
try
don't
and
know, you
uncover.
don't know. So yeah, you wouldn't know
It's
what to look for
no, so it's about actually actively going out and seeking,
and
um,
raising awareness.
yes, and getting people involved in that way. So how can how do you think institution can actually move from um statements, making to real action, to really getting them people involved?
Yeah, so it has to be institutional change. They have to be intentional and deliberate with the changes about changing the culture. So this has to come from right at the top and it has to trickle down, to the other departments. You know, Patients and the public cannot, change systemic problems. I mean, they can bring about behavioral change, but they cannot change systemic problems. And this has to come at a higher level where institutions need to ensure that this is the culture, whether that's, embedding it in grant proposals, ensuring that, applications can't be accepted unless, there's a diverse pool of participants. So it's about embedding it in the research culture from the very top.
Okay, and ensuring that those who are carrying it out have a reflective group of people that they may not normally have been able to attract as well, isn't it, really?
Mm-hmm.
So what do you think are the main barriers that prevent people from diverse backgrounds from engaging?
Well, I think that the main one is mistrust, which is extremely valid, as we know the previous health and research injustices, particularly in the Black community. So it's about addressing that mistrust, highlighting, the rules and regulations that are in place to protect, patients and their data. But I also think another barrier is very much culture. In the Black community, we're very private. We tend not to talk about personal issues such as health, as well as in the Asian community. Honor is a big thing, and it's important for them to appear well. So in diverse communities, I believe that the subject of health is still taboo.
And how can what strategies work to build trust?
Strategies to build trust, I think the main one is empathy. So it's understanding and acknowledging the past and previous health injustices. And then it's about highlighting, what's in place to protect them. Because once, I think empathy builds safety and people will feel happy to engage once there's that empathy and understanding of where they're coming from, or how they're presenting.
And once they built that trust, how can researchers then develop long-term relationships with communities?
Yeah, so I've actually written some work on that. So I've got like a few key principles. So I've wrote them down. So the key principles to building and maintaining, long-term sustainable partnerships with these communities. So it's about educating and empowering, individuals. So that's explaining, the safeguards, the rules and regulations, the frameworks that are in place to protect them, but also highlighting the benefits of engaging with research and the lack of data. So when the patients and the public understand the purpose and the protections and the benefits, they are empowered to engage with research. But then you also have, sharing information and sharing power. So, this means ensuring the patients and the public are directly involved in the decision-making process. So as I said, it's not about consultation, but it is actively working together. And then I'd say motivating and valuing people. So ensuring that you have adequate budget to remunerate participants, ensuring that you can, if they need childcare support or carer support, ensuring that you have that budget for them to engage equally. And quite frankly, say what you mean, do what you say. And it's about consistent actions and long-term engagement. Trust, you mentioned trust earlier, and like any relationship, it takes time and it takes consistency. Whether that's your friend, whether that's, a romantic relationship, it takes time before you actually trust them. So it's about being mindful of that. And the final one I have is take time, which is pointing out that, you can't rush the process, right? It has to be meaningful engagement. And this shows respect, it strengthens rapport, and it creates foundations for ongoing collaboration.
That's brilliant. When you break it down in that way, and it's delivered in that way, people will exactly what you just said. They will start to trust you. They'll listen to you, try and understand it, and then perhaps, as you said, explain the benefits to them.
Mm.
And if they trust you, they'll believe you because that's about even in business, don't you? People, it's like love. The three things like and loyalty as well because they'll be loyal to you. A new brand, you might do a whole brand of hair care, for example, and people love that brand. So as soon as something new, it's like the iPhone phones, isn't it? So as soon as a new one comes out, they just buy it. You don't even need an upgrade, but you just love the iPhone so much, you get hooked, don't you? And
Mm.
you trust the brand. So whatever
Yeah.
they come out with, doesn't matter what they say. Perhaps you don't even understand what the new one is, but they love it, so they buy into it. So I
Mm.
understand that. Well done, putting all that together. So, why is early patient involvement so important?
I mean, you would think it's a very obvious answer, but I suppose it's not to many. So I think it's about, ensuring that the research involving, patients and the public from the outset and, throughout the research cycle, as I said before, so from start to finish, as this, supports relevance, the quality of the research, the impact. I mean, it can prevent a waste of resources because if you're, you know, I think research should operate on the premise of nothing about the patient without the patient. And in doing so, you're saving resources because you're doing exactly what is needed by the patient. So therefore, you don't have to go back to the drawing board when it's not effective because you had that input from the relevant individuals with lived experience. And it just fosters, trust and transparency.
Yeah. So, what does meaningful involvement look like? Beyond just tokenism.
Yeah, so tokenism is very much about consultation and coming to the patients and the public with an idea and then asking for feedback, but the decision ultimately remains with the research team. So meaningful involvement is about actively working in partnership. So I mentioned earlier about sharing the power. So this is about sharing the dynamics, sharing the power, ensuring that they are involved in the decision making process throughout.
Absolutely. And what are some of the insights from lived experience experts um, that researchers often overlook, if you know any?
Yeah, well, I don't know if it's overlooked or if it's just a misunderstanding, because I don't think they understand, the factors that influence how people show up and how people engage with research. So, it's the systemic problems, such as housing, employment, education. This impacts, these intersectional issues impact your positionality in life, and it therefore affects how you engage with health and how you engage with health research. I think there's a lack of understanding there. I appreciate, you know, no one can be culturally competent, right? It's just impossible because, culture is ever evolving, but it's about having, that cultural humility, that awareness and that willingness to learn, and also appreciating that, disparities exist.
Excellent. And you know, when we talked about at our conference, we had a meeting and we coined the phrase, you coined the phrase, tick the box. Just explain that again today. It was such a great concept. Tick the box.
Yeah, so I think for the problem is oftentimes we don't explain why we require certain information. So, in diverse communities, particularly the Black community, we come to research with a lot of skepticism, because of, what has happened in the past or lived experience. And the minute we see those boxes that say, oh, indicate your ethnicity, we're like, no, we're just going to leave that out. But we're not understanding that these boxes are important. We want to know your ethnicity. We want to have an idea of the demographics in order for us to address the gaps. If you don't fill them in, as researchers, we cannot address these gaps, right? And I mean, like, my family's done it, because you don't have that awareness, and that's why it's so important for us to have explainers at the beginning of, these questions or questionnaires, and say and explain why it's important for us to provide this information, because it ultimately helps our community.
So what would you let one lasting question? What would you say if to any of the list anyone who's listening today, what would you say they should be thinking about what they would need to do to be able to engage more
Yeah, so
with the
what I would
research?
say, it's like a marriage. So the onus is not on one, it's on both of us. So the researchers and the patients and the public, it's our responsibility to take the necessary action. So researchers need to be mindful and adapt their approach in order to ensure that, different individuals can access research, can engage with research equally, while at the same time, diverse communities need to have an awareness of how the lack of data, the lack of input from them is affecting our outcomes and is preventing, research teams who want to improve health inequalities from getting to that, from achieving that, because we are not engaging with research. So it's a marriage, it's a partnership. We both have a role to play.
Tick the box.
Tip the box.
Tick That's amazing. Look, Sam, it's been a pleasure speaking with you this afternoon. I will arrange to get all of your details. So if anybody wants to read about you later on, or contact you, or engage in research at some point, they'll have an opportunity to do so. Thank you so much for your time.
Thanks so
Anthony.
much for having me, Lorna.
Thank you so much. Okay, goodbye.
Bye bye.
Bye bye. Bye.